Una, immunity and inflammation. Week 3. Week 3 topics: innate versus adaptive immunity, acute versus chronic inflammation, hypersensitivity reactions, autoimmune disorders, RA, SLE, MS, Hashimoto's thyroiditis and Graves' disease. Resources. Note: you may need to in Needon's Chapter 2, read more, or in Wiener and Hubert, 2023 pg. 168 to 183, 372 less, depending 375, and Chapter 25. Lewis 2023, Chapter 5, 60, 61.6, 2 pg, 1568, on your 1578, Personal and Pharmacology Notes, Unit A, Academic and Unfent Fundamentals of Nursing Pharmacology, Central Nervous System Regulation, Mood and Clinical Cognition. Experience. What is immunity? Immunity, the normal physiologic response to microorganisms and proteins as well as conditions associated with an inadequate or excessive immune, is the body's ability to protect itself from disease. It's achieved when the body produces antibodies to neutralize or destroy disease-causing organisms. Response. 3 types of immunity: innate immunity, adaptive active immunity, passive acquired immunity. Types of immune response. Collaborative learning #1. In your learning group, define, compare, and contrast the following immunity terms: innate immunity, adaptive active acquired immunity, passive acquired immunity. Examples of immunity: natural immunity, acquired through exposure to a disease organism; vaccine-induced immunity, acquired through vaccination with a weakened or killed form of a disease organism; breast milk immunity, immune globulin antibodies in breast milk give babies temporary and antibody immunity to containing blood diseases. The product that can mother has been provide exposed to immediate protection from a specific disease. Suppressed immune response. Suppressed immune responses occur when the immune system's ability to fight infections and malignancies is compromised. This can be categorized into primary immunodeficiency, secondary immunodeficiency, primary immunodeficiency. Definition, characteristics, examples, management. A group of genetic disorders where the immune system is inherently defective. These are typically present from birth, often diagnosed in infancy or early childhood. Increased susceptibility to infections, autoimmune diseases, or malignancies. Severe combined immunodeficiency (SCID), a lack of T and B cell function, often called bubble boy. Disease, DiGeorge syndrome, a T cell deficiency caused by a thymic developmental defect, X-linked. Agamoglobulinemia, XLA, B cells fail to mature, leading to a lack of antibodies. Bone marrow transplantation, immunoglobulin replacement therapy, gene therapy emerging, treatments. Secondary immunodeficiency. Definition, causes, examples, management. An acquired condition where the immune system is weakened by external factors, infections, HIV/AIDS leading to depletion of CD4 plus T cells, medications, immunosuppressive drugs used in organ transplants or autoimmune disease. Treatment, for example, corticosteroids, chemotherapy, chronic diseases, diabetes, kidney failure, or cancer. Malnutrition, lack of essential nutrients like protein, zinc, and vitamins. HIV/AIDS, progressive immunosuppression due to viral destruction of CD4 plus T cells. Cancer therapy-induced immunosuppression. Treat the underlying cause, for example, antiretroviral therapy for HIV. Supportive care with prophylactic antibiotics and vaccines. Consequences of suppressed immune response. Infection, bacterial, fungal, viral, cancer. Exaggerated immune response. Exaggerated immune responses occur when the immune system overreacts to harmless antigens or normal body tissues, causing tissue damage. These include hypersensitivity reactions types IV and can have localized or systemic effects. Hypersensitivity reactions types IV. Type 1, immediate hypersensitivity. Type 2, cytotoxic hypersensitivity. Type 3, immune complex mediated hypersensitivity. Type 4, delayed type hypersensitivity. Mechanism: mediated by IgE antibodies binding to allergens causing mast cell degranulation and histamine release. Examples: allergic rhinitis, hay fever, asthma, anaphylaxis, systemic and life-threatening. Localized effects: sneezing, itching, hives, bronchoconstriction. Systemic effects: anaphylaxis causing hypotension, airway swelling, and shock. Management: antihistamines, corticosteroids, epinephrine for severe cases. Mechanism: IgG or IgM antibodies target specific cells, leading to complement activation and cell lysis. Examples: hemolytic anemia, Rh incompatibility, hemolytic disease of the newborn, Goodpasture syndrome. Localized effects: organ-specific damage, for example, kidney, lungs. Systemic effects: hemolysis, systemic organ failure in severe cases. Mechanism: antigen-antibody complexes deposit in tissues, triggering inflammation via complement activation. Examples: systemic lupus erythematosus LA, post-streptococcal glomerulonephritis, serum sickness. Localized effects: tissue inflammation, pain, swelling. Systemic effects: fever, joint pain, multi-organ damage, and lupus. Mechanism: mediated by T cells, not antibodies, and occurs 24 to 72 hours after antigen exposure. Examples: tuberculin skin test, PPD test. Contact dermatitis, for example, poison ivy, nickel allergy. Graft versus host disease. Localized effects: redness, itching, and swelling at the site of exposure. Systemic effects can occur in severe autoimmune conditions. Consequences of exaggerated immune response: acute hypersensitive reaction, chronic body-wide system disease. Localized effect: destruction of body tissue. Systemic effect: abnormal organ growth, change in organ function, altered immune response, populations at greatest risk. Collaborative learning. 2. In your learning group, list the populations at greatest risk for altered immune function. Discuss comparisons of a suppressed immune response and an exaggerated immune response in these populations. List individual risk factors for altered immune function. Compare and discuss these risk factors in terms of a suppressed immune response and an exaggerated immune response. Risk factors: populations at greatest risk. Inflammation can affect all individuals, regardless of age, gender, race, and socioeconomic status. The populations most at risk for a severe or ineffective inflammatory response are the very young, very old, uninsured. What is inflammation? Inflammation is an immunologic defense against tissue injury, infection, or allergy. Is part of the biological response of body tissues to harmful stimuli, such as pathogens, damaged cells, or irritants. The 5 cardinal signs are heat, pain, redness, swelling, and loss of function. Inflammation scope ranges from no inflammation to active inflammation. May be localized or systemic. Active, acute inflammation may ein chronic. B, in French, repair, restorative. See Figure 2021 in the text. Purpose, key features, cellular players, examples, outcomes. A rapid and short-lived response to injury or infection, typically lasting from a few hours to a few days, to remove the injurious agent and initiate tissue repair. Onset: immediate or within minutes of injury. Duration: hours to a few days. Signs: redness, rubor, heat, calor, swelling, tumor, pain, dolor, and loss of function, functiolasa. Mediators: histamine, prostaglandins, bradykinin, and cytokines. Neutrophils are the predominant immune cells. Mast cells, platelets, and macrophages also play roles. Acute appendicitis, skin wound or laceration, acute infections, for example, bacterial, pneumonia, resolution, injurious agent removed, and tissue returns to normal. Progression to chronic inflammation if the insult persists, scarring or fibrosis if damage is severe, steps in an acute inflammatory response. See Figure 23.2 in the text. Tissue injury and the release of chemical mediators, vasodilation, and increased blood flow, swelling, and retraction of activated endothelial cells. Increased vascular permeability and leakage of small plasma proteins, walling off movement of immune response cells to the site of injury, exudate formation movement of glucose and oxygen to the site, needing repair, release of chemical repair factors from activated endothelial cells. Chronic inflammation. Definition: a prolonged inflammatory response that persists for weeks, months, or even years, often due to a persistent injurious agent or failure to resolve the acute phase. Purpose: a maladaptive response that may result in ongoing tissue damage and impaired healing. Key features: onset, gradual, often following unresolved acute inflammation. Duration: weeks to years. Signs: less pronounced redness and swelling compared to acute inflammation, but ongoing tissue damage, fibrosis, or organ dysfunction. Mediators: chronic production of cytokines like IL-1, IL-6, and TNF-alpha. Cellular players: in rheumatoid arthritis, autoimmune-driven. Macrophages, lymphocytes, T and B cells, and plasma cells dominate. Fibroblasts contribute to tissue remodeling and fibrosis. Examples: in tuberculosis, chronic infection. Chronic hepatitis, viral persistence. Outcomes: tissue destruction and fibrosis. Granuloma formation in certain conditions, for example, tuberculosis. Predisposition to malignancy, for example, chronic hepatitis leading to liver cancer. Repair, restorative inflammation. Definition: the phase of inflammation focused on tissue healing and repair after the acute or chronic phase. Purpose: to restore tissue integrity and function, either by regeneration or scar formation. Key features: resolution of inflammation, removal of inflammatory mediators and cells. Cellular players: macrophages switch to a reparative phenotype, M2 macrophages. Fibroblasts proliferate and secrete extracellular matrix ECM proteins like collagen. Endothelial cells promote angiogenesis to restore blood supply. Processes: regeneration, replacement of damaged cells with the same cell type, for example, liver or skin. Fibrosis, scar formation, replacement of damaged tissue with fibrous connective tissue if regeneration is not possible. Examples: healing of a skin wound with scar tissue. Liver regeneration after partial damage. Outcomes: complete restoration of tissue function if regeneration is successful. Functional but structurally altered tissue if fibrosis dominates. Site morsel: key differences between types of active inflammation. Repair, restorative inflammation. Feature: acute inflammation, chronic inflammation. Duration: short, hours to days, prolonged, weeks to variable, follows resolution. Years phase: main neutrophils, macrophages, M2, fibroblasts, cells, lymphocytes. Outcome: resolution, chronicity, or fibrosis. Tissue destruction, regeneration, or scar formation, fibrosis. Purpose: eliminate pathogen. Damage, persistent response to tissue healing and repair. Insult. Examples of injury causing inflammation. Collaborative learning. Third, in your learning groups, discuss examples of the types of injury that lead to inflammation. Be sure to think of examples at different stages of the lifespan. Discuss the role various pharmacological agents have in the treatment of inflammation. Think about at least one specific example of each drug category. Rheumatoid arthritis raw. Definition: rheumatoid arthritis raw is a chronic, systemic autoimmune disease characterized by inflammation of the joints and surrounding tissues. Epidemiology: affects approximately 1% of the global population. More common in women than men. 3:1 ratio. Typically manifests between ages 30 to 60. Impact: RA can lead to significant disability and reduced quality of life if untreated. Rheumatoid arthritis raw. Etiology: exact cause unknown, involves genetic predisposition and environmental triggers, for example, smoking, infections. Pathophysiology: immune system attacks the synovium lining of the joints, causing chronic inflammation. Inflammatory cells release cytokines, for example, TNF-alpha, IL-1, IL-6, leading to joint destruction. Formation of pannus abnormal tissue erodes cartilage and bone. Systemic effects can affect other organs such as the lungs, heart, and eyes. Pharmacological treatment for RA. Disease-modifying antirheumatic drugs, DMARDs examples, methotrexate, hydroxychloroquine, sulfasalazine. Purpose, slow disease progression and prevent joint damage. Biologic agents, examples, adalimumab, etanercept, infliximab. Purpose, target specific immune pathways, for example, TNF-alpha inhibitors. Non-steroidal anti-inflammatory drugs, NSAIDs examples, ibuprofen, naproxen. Purpose, reduce pain and inflammation. Corticosteroids examples, prednisone. Purpose, control acute flares and severe inflammation. Nursing considerations, monitor for side effects, for example, liver toxicity, infections. Educate patients on proper medication use and need for regular lab tests. Case study, patient profile, 45-year-old female presents with joint pain and stiffness in both hands and wrists for 6 months. Symptoms worse in the morning. Reports fatigue and low-grade fever. What discussion questions? 1. What are the key nursing assessments for this patient? 2. What pharmacological treatments would you recommend? 3. How can the nurse support this patient in managing her condition? And what discussion questions? 1. What are the key nursing assessments for this patient? 2. What pharmacological treatments would you recommend? 3. How can the nurse support this patient in managing her condition? And summary, inflammation initiation and chemical mediators. Tissue injury triggers inflammation, physical damage. Pathogens or chemical irritants activate the immune system through pattern recognition receptors, PRRs, detecting damage-associated molecular patterns, DAMPs. Role of histamine. Histamine, released from mast cells and basophils, causes vasodilation and increases capillary permeability, promoting fluid and immune cell movement to the affected area. Cytokines and leukotrienes. And cytokines regulate immune cell communication and migration, while leukotrienes contribute to prolonged inflammation and bronchoconstriction, aiding in immune cell recruitment. Prostaglandins in pain. Produced from membrane phospholipids, prostaglandins mediate vasodilation, pain sensitization, and fever, supporting local and systemic inflammatory responses. Chemotaxis factors. Released by mast cells, these factors attract leukocytes to the site of inflammation, enhancing the immune response through focused cell movement. Supplement system activation. The complement system amplifies inflammation, opsonizes pathogens for phagocytosis, and directly lyses target cells to aid in pathogen elimination. Leukocyte involvement in exudates. Neutrophils serve as the first line of defense in acute inflammation, with purulent exudates indicating active infection requiring intervention. Resolution phase, resolvins and lipoxins suppress ongoing inflammation, facilitating tissue repair and transition from inflammation to healing. Next week, an asynchronous. Continue immunity and inflammation applying to IND topics, allergies and hypersensitivity disorders, infectious disease, HIV/AIDS, cancer and immune system, role of surveillance, tumor-associated inflammation. Quiz 1, 5%. Respondus will be used. 9 closes Friday 17.